Hi, folks. In 2019, according to statistic.com, 13.2% of the US population is disabled. According to my math, since there's currently 331.5 million people in our country, that comes to roughly 43.75 million people. That being said, if you compare that to the Social Security Administration statistics related to the total percentage of Social Security expenditures that are paid towards Social Security disability benefits, which is 13.1%, and then you divide that by the average Social Security disability benefit amount that's being paid out, which is currently $1,277, it comes to roughly 10.8 million people that are collecting Social Security disability benefits at the moment. That means if there's 43.75 million people disabled and only 10.8 million of them are collecting Social Security disability benefits, 75% of those people are currently not collecting disability benefits right now. Now, I'm sure there's plenty of good reasons why this is the situation, but it definitely makes one think that there's a need to educate a lot of people about these benefits. And that's exactly what we intend to do in our workshop today. My name is Brian Dougherty of PLC Financial Solutions, and I'm your host for today's webinar, along with JDoc, the Executive Director of the Injured Workers Advocacy Program and principal of PhillyLabor.com, the Philadelphia Union Community's online media hub, and host of the Labor Show on 1210 AM Talk Radio. How you doing today, JDoc? Uh-oh, did we lose JDoc? I guess we did. Anyway, also, as usual, we're here with my beautiful partner in business and life, Rachel Dougherty. Say hi to Rachel. Say hi, Rachel. Hope Rachel's there. And she's also going to be our moderator for this also. And now, because we always aim to please on our webinars, we also have an extra special co-host with us on it. And he's the Philadelphia area's foremost expert in Social Security disability from Philadelphia's top Social Security disability and workers' compensation law firm, Lehocy, attorney at law, Tom Giordano. How you doing tonight, Tom?
Brian, I'm doing great, man. I got to tell you, I got to get you to announce me every day, man. This is fantastic. I love that energy. Really happy to be here. Thanks for having me.
Well, I'm so glad, but you know, with the history that we have and long time knowing each other and, you know, years in the making, this whole thing, I couldn't be more sincere about that, believe me. So I'm as excited as anybody about this for sure. But before we get started, let's take care of some general housekeeping first. So one, if the screen is not big enough for you, you can click on the View Options drop down at the top right of your screen to make it larger. Also, you'll see that there are two boxes at the bottom of your screen. One called Chat, it's for your comments, and another called Q&A for your questions. Please use them accordingly, and Rachel will respond to them in kind. I'm sure that many of you also have questions about this material that we're going to cover today. But since we have a good bit of material to cover and only an hour to cover it, I'm going to ask you to put your comments and questions in those boxes below. And at the end, we're going to be staying for some extra time to cover as many of them as possible. However, if we don't cover yours, we'd be happy to answer them either by email or even a 15-minute Q&A phone call scheduled for another time. Next, this webinar is going to be recorded. It is being recorded, and it will be sent to everyone who was attending tonight. So don't worry about missing anything. You're going to have a chance to check it all out again at your convenience. Also, because we want to make sure that you're all paying attention, and because we also like you to have some fun as well, before we answer any questions, we have a 6-question quiz for you at the end. And the first person to answer each question right inside the comment box is going to win a $10 gift card to the store of your choice. So make sure you have a notebook handy to jot down some brief notes related to some special bullet points that I'm going to point out as we go along. And finally, it's my obligation as a financial advisor and a fiduciary to inform you of our RIA's disclaimer statement, which is that our investment advisory services are offered through Fusion Capital Management, an SEC registered investment advisor, and we only transact business in states where we are properly registered or are excluded or exempted from registration requirements. And the SEC registration is not an endorsement of the firm by the commission. It does not mean that our advisors have attained a specific level of skill or ability. And most importantly, all investment strategies have potential for profit or loss. So now that we got through that, I have one for you. What did so a robber walks up to an IRS agent in the park, points a gun at him, and he says, "Give me all your money." The IRS agent says back, you can't rob me. I'm an IRS agent." The robber says, "Well, in that case, give me all my money." All right. I'm going to keep my day job. How's that sound? Okay. All right. So now let's jump in. So when it comes to Social Security disability, let's just start with a little bit of general information related to it. Disability benefits were added to the Social Security program in 1956 under President Dwight D. Eisenhower. It was not a part of the original Social Security Act in 1935. Also, the purpose of Social Security disability benefits is to provide monthly benefits for people who are unable to work or perform substantial gainful activity, or what they call SGA. And we're going to get into that with Tom in a minute. But that's the basis of what Social Security is. And you have to understand that SGA part, because that's where it gets a little complicated, right, Tom?
That's right.
Also, if you'd like to have an idea of how much your Social Security benefits would be if you were approved to receive them today, an estimate of what your Social Security disability benefits amount will be is actually given on your Social Security statement. We're going to show that. So let's back up a minute before we go over that. Tom, can you tell us more about the Social Security Administration's how they define substantial gainful activity?
Yeah, and Brian, it's a big 3-word phrase, right? But it's easy. So essentially, if you're working right now, and let's say you're like many of us who are working with pain, with problems. I know people who have cancer, they're still working with cancer. If they're making more than $13.10 a month gross, okay, $13.10 a month, they cannot be considered disabled. So how I use that 1310 number is that's a baseline. If you're out of work because of any medical condition, or if you're working and you're earning less than 1310 a month gross, you can apply for disability today. So that I use that number as my first step in the process. Are you out of work or are you making less than 1310? So the people on this webinar, if you're working in pain, and we're going to talk about this, I know, but you're making more than 1310, SSD is not right for you. Social Security disability, sorry, I'm using an acronym. I didn't even talk about it yet. Social Security disability is not right for you now, but could be when you stop working, or for our union brothers and sisters on the call, when they retire, start collecting their pension, they can apply for disability. But I'm getting ahead of myself.
Right. Okay. And also, too, in your experience, how accurate really is the Social Security statements where it talks about how much your disability benefit amounts would be?
That's one thing I got to give Social Security credit on, right? They're pretty accurate with that. Now, obviously, we get a raise we're supposed to get a cost of living adjustment. And this year, I'm really pleased to say that, or I'm sorry, in 2022, we're going to get a 5.9%. So if you look at your statement, tack 5.9% on that. That's what you'll get. That's what you'll get next year. So
that's actually, you've seen that.
Oh yeah, that's set in stone. Everybody's getting a raise in 2022. which I'm happy about, 5.9%, but your Social Security statement is fairly accurate. The only time it's not accurate, Brian, is if you haven't reported your income for those years. So, you know, if you're a little late on your tax returns, well, they're not going to see what you've made and paid into. So that's why it wouldn't be accurate, but typically it's accurate.
Okay. Yeah. So now on that note, so you can see here, this is just an example of a typical Social Security statement, the page where it shows it, this second blue line where it says disability, across from that, this one particularly says $1,889 a month. Yep. That would be it. Then you'd tack on obviously whatever the COLA adjustments is going to be, right?
Yeah. And if Brian, I don't want to steal your thunder, but this is such an important slide that you put together, because so many people, they used to mail these to our houses. They don't do that anymore because it costs too much money. Now we have to go online. But look at that. Look at what your full retirement is. 66 and 10 months. This individual, whoever this is, at 66 years and 10 months gets $19.15 a month. Well, their disability rate, and this goes for everybody, is typically the same. It's just a few dollars off, right?
Right.
So I want you to think about this. You're a 55-year-old union carpenter, okay? You stop working because you can't do it anymore at 55. You can get your disability benefits at 55. That's almost equivalent to what you would get at 66 and 10 months.
Yeah, your full retirement age.
Right. That's an 11-year head start. I know so many people, union and non-union, who wait until they're 62, right? They say, I'm going to work until I'm 62. I'm going to, even though I'm having problems, I'm going to fight to go to 62 so I can get my retirement. Well, look at that reduction in your retirement at 62. This guy or gal right here is getting $500 less at 62 than they would get in disability. So why suffer, right? Why suffer until you're 62? Go out early and get your full disability rate, which is equal to your full retirement rate. To me, it's a no-brainer.
Absolutely no-brainer. Absolutely. So let's talk about the rules of eligibility. Okay. So, and this applies to both Social Security disability and supplemental security income, otherwise known as SSI. First thing being the work history qualifications have both age and duration tests related to them. We're going to talk about that. Second, you must be under your full retirement age, which is currently 66, although there are some exceptions on how that can be, right?
Correct.
Third, your conditions must be considered a Social Security defined disability, which is what we're going to talk about as well, right? And finally, you must have filed an application. That seems so basic, but when you actually look at the application process, it's a little in depth, and so that's not to be undermined or underestimated, so to say, right?
Yep.
Anything related to this, or anything you can think about that you would elaborate on this, related to these qualifications?
Yeah, and I know what the next slides are because you were kind enough to share them with me, and I think we're going to hit each one of these. But the one thing I would tell the audience today, when they see that third bullet point, a Social Security defined disability, I don't want that to scare them. I mean, and I'm going to belabor this point all day, all night. You can get Social Security disability for any medical condition whatsoever, physical or mental. And I mean, I'll go through the list later, but I'm talking, the majority of our clients have pain. It's pain, back pain, knee pain, neck pain, elbow pain, hand pain, diabetes. I mean, you literally, so I don't want that to scare you. Oh, I need to fit under this perfect definition. You don't, but everything else on there, I know we're going to go over in a little bit.
Okay. All right. So let's go with the first one, the duration or the age work test. So as far as age goes, and this is a little surprising, I think, was for me. The two ages that are measured from to start with are age 24 and age 31. Although technically you can collect SSD starting at age 18 if you have the credits. Am I right?
You're absolutely right.
So, and it works kind of like this, right? So before the calendar quarter in which you turn 24, you must have earned at least 6 credits, which is equal to a year and a half, right, of work, consistent straight through work.
Correct.
In the prior 3 years, to pass the recent, what they call the recent work test, right? Now, between the ages of 24 and 31, these are the nuances, right? You must have spent at least half that time since you turned the age 21 in what the Social Security Administration considers to be covered work, right? So talk about that in a second. And then beyond 31, it gets a lot easier, right?
Sure
The
does.
test is 5 years or 20 credits of work in the decade. Now, you mentioned this on the radio show the other day, immediately before you become disabled, right? So when it comes to those rules, now, is there anything, first of all, how often do you see these younger ages become obstacles?
It's not, I will say this, a majority of our clients are 50 and up. Now, does that mean you can't be 18, 19, 20, have a serious accident, have, God forbid, cancer or something else? Yeah, I mean, clearly it doesn't matter what your age is. What I like about these rules, I can make this real easy for the audience. If you're over 31 years old, if you've worked 5 out of the last 10 years and you've worked in jobs that you've actually paid taxes,
right,
you're technically going to be eligible for disability. So 5 out of the last 10 years, if you worked, you're going to be eligible. If you paid taxes, done. What I like about these younger ages rules is they understand that somebody who's 24 is probably not going to have the ability to work 5 out of the last 10 years because 10 years ago they were 14. Right. So they're not, my first job was in high school. That's not true. I was in Philly working at a water ice stand when I was 10, but I probably shouldn't have been able to do that.
Right.
But the point is, they make it easier for younger people. You don't have to work as much. To me, that's the easiest way to say it. If you're under 31, you don't have to have that many quarters of coverage to be eligible. But for everybody on this webinar who's over 31, if you've worked 5 out of 10 years, you're pretty much good to go.
I'm pretty sure it's close to 100% as well.
Yeah.
So,
yeah.
All right. So that covers that. You could get deep into those weeds, but I don't think it's worth it, right?
Yeah, I agree with you.
So when it comes to work, the work duration test, it goes like this. If you're younger than age 28, the duration test is, again, 6 credits or a year and a half of work. That easy, right? Under 28, that's it. That's what you need, right? Now, at age 28 or older, you must have, this is where they start getting you, right? You must have at least as many credits as the number of years since you turned age 22. So some examples of that are this. So if you become disabled at age 30, you need to have worked at least 2 years or have 8 credits, right?
Yep.
At age 40, it's 4.5 years or 18 credits. At age 50, 7 years or 28 credits. And at 60, 9.5 years or 38 credits. So it's really just shy, right? Of what, and this is the final one. Once you make it to 40 credits, it does not matter.
Yeah.
You pass it anyway, which you're basically talking about, right? 10 years, 40 quarters.
But Brian, let me say this. For anybody out there who's just not like, look, math's not my game either, okay? And I know it's your game. It's not mine. I'm not good at math. You want to know if you're eligible? Log on to Social Security, get your earnings statement. If there's a number on what you'd be entitled to in disability, you're eligible. If there's no number there, and you don't have, they'll tell you don't have the credits to apply. I mean, I appreciate you educating and giving them the right, but if you're just saying, I just want to know if I'm eligible, log on and find out.
Cut to the chase.
That's it, man.
All right. So now this is where I think it gets a little, it's important, right? So Social Security Administration uses what's known as the Social Security Blue Book, right? When it comes to doing their disability evaluation under Social Security. These Blue Book details can actually be found at their SSA.gov website in an area where their online compendium is, right? So they actually have it all online, right?
Yep.
You can go see it. And this is basically a list of both physical and mental health disorders that are automatically, it says, qualify you for both Social Security disability and SSI if you have one that's on the list. Now, it's worth noting that the Blue Book list, now this is, I thought, interesting. This list of conditions are separated into two categories, Part A and Part B. Now, this is the one I wanted to ask you about.
Go ahead.
Part A is made up of all adult conditions, and Part B is
Correct.
made up of all children's conditions. Now, Tom, can you expand on this for us? Are there actually that many conditions that are exclusive to adults and children to warrant these two different categories?
All right, so I want to put the audience, I want to put them at ease because I'm sure this is like, oh man, my head's spinning, right? I want you to picture they have this book, maybe like a book that's this big, right? And it's got every medical condition under the sun, and every medical condition has a list of, well, if you have a bad spine, do you have a herniated disc? Do you have this, this, and this? And if you match up, you automatically get it. And should they have an A and a B? The only reason they have an A and a B is because not every adult condition is applicable to a child condition, but pretty much they're identical. They're pretty much identical, Brian, okay? But here's what I would say for the audience. Don't even worry about this blue book of disability. If your medical conditions are keeping you out of work, it's okay if they don't meet or equal the perfect definition in this book, because you could still win. Now, yeah, you said something exactly right. If it meets the exact definition, it's an automatic win and it's great. But here's what lawyers will tell you who practice this every day. It's rare that your conditions meet that perfect listing, right? It's more like, hey, I have such bad back pain that I can't focus and concentrate to do a job 8 hours a day, 5 days a week on a consistent basis. I'm in so much pain that there's literally no position that I'm comfortable in. That's not going to be in a book, right? That's how are we going to prove that? We're going to just prove it by getting your doctor's records and sending them to Social Security and say, okay, we don't meet a listing. We acknowledge that. You got us. But here's what we do. We have an individual who literally can't get comfortable because their back is hurting them so bad. They've had injections, they've taken medication, and nothing, they've even had surgery, let's say, and nothing has worked. So yeah, you're dead on with this book that if it matches, it's good. But I don't want this audience here to think that they have to be perfect. It doesn't have to be.
Yeah,
perfect.
it's the tell all for it. And I think that was one of my big question I had for you. So you definitely jumped on that a little early. Now, this here, so obviously there are special qualifications. There's actually a special qualification list. It's called the Compassionate Allowance Program, otherwise known as the CAL program, CAL. And now what's interesting about this is these are conditions that will qualify an applicant for what's known as expedited ruling, right? So currently, as of 2021, there's 254 conditions on the list. And as you can imagine, they're all pretty serious conditions which warrant an expedited ruling or process by the SSA. Now, these include conditions like fast-moving cancers, immune system and neurodegenerative diseases, rare genetic disorders, and other illnesses that by definition that meet Social Security standards for the not only the ability to prevent for disability and prevent suffering from working, but they're also a lot of them likely to result in death, right?
Absolutely.
Yeah.
I mean,
so give us some examples of things that you've seen on and off this list.
Yeah. So by the way, I love that Social Security decided to do this because, in the past, before they did this, and I'll give you the one that hits me closest to home, right? My uncle served in Vietnam, and because of Agent Orange had Lou Gehrig's disease, ALS. Okay. I think everybody's familiar with ALS. And in the past, ALS, unfortunately, is a death sentence. You get ALS. There are been some successful people who have lived a long life. Steve Gleason is one I can think of, the football player, the New Orleans Saints, but that's rare. They would have to wait sometimes 2 years. They would have passed already in that 2-year period. So disability comes up and says, we're going to have this compassionate allowance, and you hit it, 254 conditions. Probably the most common that I've seen is ALS, is adult non-Hodgkin's lymphoma. pancreatic cancer. You said fast moving cancers. Pancreatic is probably one of the worst you can get in terms of fast moving. Esophageal cancer, and then end stage renal disease. So, if anybody on this webinar knows someone who has any of those conditions, they not only should they apply and they'll likely get it. If this process takes in general anywhere from 6 to 18 months, for them it'll take probably 3 months tops.
Oh, that's what I was going to ask you, 3 months.
Yeah.
So that's considering the Social Security Administration and disability, that's
as fast as
amazing.
you can ask for. You're exactly right, Brian.
Absolutely. All right. So now let's talk a little bit about the application process. First off, you need to file either an application online or call for an appointment at 1-800-772-1213, or you can walk into a Social Security field office, although I don't think right now they're open, right?
Yeah, not yet. You can't walk in yet. Since March of 20, you haven't been able to walk in anywhere because they've all been closed.
Okay, and the disability, you have to complete a disability benefit application, right?
That's correct.
And medical evidence must be provided as it relates to the condition, and it can come from either directly from you or your medical providers, but that's usually 99% of the time where they get it, right?
Yeah, exactly right.
Okay, so people, in other words, they don't got to worry about chasing all those records around.
No, they don't. No. And and when you're done, I'm going to give some really big tips on this. So keep going. Sorry.
Okay. So, and the final thing is you have to complete a disability report submitted with your case. It has to have your date of onset, traumatic versus date last worked, name, address, and dates of visits to hospitals, doctors, clinics, etc. I'm certain you're more familiar with that. I have never heard of that.
Yep.
Is that part of the application? Or?
Yeah, that's part of the application. Absolutely.
Okay. So that's pretty much the basis of it. Or is there anything you want to add to that? Or
so here's what I would say. You said it right. You could file online. You can call the old days, and hopefully someday soon you can walk into an office. There's a fourth way, and I promise, and you know this, you and Joe know that I never push lawyer services on anybody, but obviously the other option, and one that we quite frankly do all the time, is file an application for you. And a lot of people like that option because look, we know what we're doing. It is a few, it can get a little tedious. It's long, but anybody out there who's thinking about applying on their own, what I would tell you is the most important thing that you will do is a combination of number 3 and number 4. And that is make sure you list all of your doctors on that application. Because if you leave out a doctor who's treating you for your medical conditions, they will never request records from that doctor. And if they don't request records from that doctor, then it's almost like that doctor doesn't exist in your world. So they're going to make a determination on your case without maybe some very key medical evidence, right? So, a good lawyer who does this type of work, whoever it is, as long as they specialize in disability, knows that the information they put in the application sets the tone for the entire case.
Absolutely.
Yeah.
We're going to go through just quickly, talk a little bit about, and this can be good, can be bad in some ways. I guess, what about termination of benefits? Let's talk about that, how that works. There's basically 4 main ways. First, being through a medical continuing disability review, or CDR. Second, through a work continuing disability review. Third, through the submission of new evidence. And finally, through reports that are given from the public. So give me some feedback about these 4 and how they apply to a situation. Is this involuntary, or is it voluntary, or in these?
So this is really focused on somebody who's on disability right now. But let me say something for those who are thinking about it. Social Security disability is neither permanent or temporary. It's really for as long as you need it. So there's a lot of people who are hesitant. You gave some amazing stats in the beginning of this, that there's maybe 30 million people who are disabled, but they probably haven't even thought about applying, right? Maybe some of those people haven't thought about applying because they don't want to be branded disabled for the rest of their life and think they can never work again. That's not true at all. In fact, you can get off of disability at any time by just going back to work after all. So that's one that's not necessarily on here, but you can terminate your benefits by just saying, you know what, I'm healthy. I'm going to go back to work. That's number one. But for people who are on disability, for you to want to stay on disability, the most important thing you can do is continue to see your doctor, right? So every now and then, the younger you are, Social Security will do these CDRs, continuing disability reviews. And all they're doing is they're just requesting records from your doctor. And if they see you haven't been to a doctor in 5 years, then they're going to probably think you're not disabled anymore. So they could potentially terminate your benefits that way. Reports from the public. This is a tip that I give all of my clients, and I'm happy to give it to the audience today. Nobody needs to know you're on Social Security disability. The number one reason people get taken off of it is because a jealous potential neighbor, friend, family member, stranger thinks that this guy's on disability. I saw him mowing his grass. Well, let me tell you something. Just because you can mow your grass doesn't mean that you can work 40 hours a week as a painter, doing that work 40 hours. Just because you can mow your grass and have one good day doesn't mean you should get your benefits taken off. So, I always tell people this is a very personal thing. Nobody needs to know, and just don't tell anybody. And that'll never happen, right? You'll never get reports from the public because it won't matter.
Right. No, absolutely. And obviously, there are, that's unfortunate. So some of these things you're talking could be voluntary and some of them could be involuntary, obviously. But obviously people should be aware of them.
I mean, seeing, Joe, I'm not joking, just seeing Joe spark something that him and I have talked about before. And I think the biggest misconception out there is that you have to be bedbound or you have to literally be in your house 24/7 to be considered disabled. And that's absolutely incorrect. The standard is, can you sustain 40 hours of work per week on a consistent basis? So if you have more bad days than good, but you still have some good days, you could be disabled. And I think that the public out there who's potentially, and I'll use a slang term from the city, ratting people out, well, it's because they think, oh, this person's not disabled. Well, what if you have a mental health issue? How many people do you know who are dealing with mental health? They look perfectly healthy. They're great. They're going to the gym, but mentally, they just can't sustain that work 40 hours a week. So if they're outside doing something, are they, they're not disabled because they're able to, carry some garbage out? Absolutely not.
Yeah, no, absolutely. And a lot of people, like you said, there's a long list of mental disorders as well. And those types of things you can't see.
Yep.
So, all right. So jumping in here.
Did you have a question or are you waving?
I'm waving because I wanted to, first off, can you hear me?
Yep.
All right. So first of all, I want to welcome all of our union leaders and union members here and also members of the general public. This is fantastic information that we're talking about with Social Security disability.
So we're looking up your nose. So you got to keep the, yeah.
How you doing? All right.
Yeah.
I'm a rookie. I'm a rookie at these things, but having said that, one of the things I'd like to say is it's so important, and I'd like to Tom to address the issue. There's so many people out there working in pain every day, trying to hang on until they retire. And our unions, we have great benefits and all those things. But one of the problems is, people don't understand and they're not educated on the benefits of that somebody can get if they've been working in a trade like that Tom mentioned, carpentry, whether you're a Boilermaker. Shout out to John Bland, business manager of the Boilermakers, who's on the line, and Joe Inimer, the president of Graphics Communications Conference, International Brotherhood of Teamsters. One of the things I'd like Tom to do is explain how that works in regards to, Tom, you mentioned it really well, that, you don't have to be catastrophically injured. You may be working in pain and just unable to do the same job at the same level you've been doing your whole life. Right. But explain also how, and we'll get into the Medicare in a little while, but explain how, somebody who's not disabled can apply, and how it also benefits their union and their health and welfare.
Yeah, I mean, so one of the things that I'm most proud of what we've done over the last 10 to 15 years is what we're doing for union members. How many union members do you guys know that when they retire, they're perfectly healthy? I mean, the physical nature of the jobs, the bending, the lifting, the squatting. I mean, you're retiring. You got herniated discs. You got bone on bone. So these individuals who've gotten to that point of retiring, we've talked about this a million times. It's got to be a checklist. It's literally got to be on your checklist of retirement to apply for Social Security disability. Just because you're retiring and you're saying, I'm going to go down the shore and I'm going to fish. That's all I'm going to do. Well, that's okay. But could you do that Boilermaker job 40 hours a week anymore at the age of 56? No. So get your pension and apply for Social Security disability. The only thing I would tell anybody who's listening from any of the trades is that if you haven't seen a doctor for any of your problems, you've just been dealing with it. I mean, how many guys do we know and gals do we know that it's like, I got to take my Advil and my Tylenol with my coffee to go to work? Well, that got you through it, but obviously you need to see a doctor so I could show that there's an MRI with the bad back or the bad knees, things of that nature. But Joe, it is a no-brainer that if you're retiring from any job, but let's just use our trades, right? Let's just use the trades, and you have pain, you got to apply. You have literally nothing to lose, and up to $3,000 a month in addition to your pension to gain. I mean, it's a game changer, man.
And also, Tom, is there a cost to apply?
No, there's no cost to apply. There's absolutely no cost. And if you hire a lawyer, the only time you ever pay a lawyer, and we all get paid the same, it's if you win and you get retroactively paid, so you get some back money. The lawyer gets a one-time 25% cut, no more than $6,000, and then you get that rest of it, and then you get a monthly check. And then the Medicare piece, which I don't want to step on Brian's toes because I know you're going to be talking about this, but the Medicare that these members are getting. Well, what happens then is you start using Medicare and you don't have to use your union provided medical insurance. It's actually saving your health and welfare fund money. So it helps everybody. It helps the union. It helps the member. I mean, I'm telling you, there's not a downside. This is not gibberish. This is not a downside at all.
And Brian, one of the things that I'd like to ask you, while everybody's on the line here, and on the webinar, there's statistics. I know you talked about when members want to fill out the application themselves. There's actual statistics from the Social Security Bureau that what is it, Brian, that if you file with an attorney, the percentage of success compared to not doing so, what is that?
Well, that was going to be our next slide anyway. So what a lot of people don't realize about using an attorney or what they call professional representation, that you're not required, but you have a right to it, they say. Okay. And that's a big deal. People, I don't think understand it's actually a right. And that, professional representative, it can be either an attorney or what they call a disability advocate who isn't a lawyer but has passed an SSA administered exam. But in 2017, a study by the Federal Government Accountability Office found that people who were represented at disability hearings are nearly 3 times more likely to be successful. And so that's coming from the federal government, right? Accountability Office. So it really makes no sense. And I know people who've been through this process. It makes no sense to try to do it on your own. You could go online and do it. They say 10 minutes, right? It'd be the worst 10 minutes.
It's not going to, listen, I can't make it as a lawyer. I can't make guarantees. It's going to take longer. I can guarantee it's going to take longer than 10 minutes.
Yeah, but guys, one of the reasons I bring it up is this. The process can be a little bit timely. The last thing in the world, and I've said this, and we've talked to many union members who've tried to do it on their own and left something off or made a mistake and didn't find out for 6 months. So the success rate is obvious, and obviously, Tom, he's the foremost expert in the region. But the truth is, we're trying to, if you have an application, you want to make sure that it's accurate, it's done right, there's no mistakes, because it's a hard lesson to learn 6 months down the line when you get denied because you didn't fill out the application properly. And it's not just like a lot of extensive applications. It's not the easiest thing, obviously, if you don't have experience doing it. That's why it's an important point. Even though 100% you have a right to do it yourself, and by all means, if you feel that way, do it. Good, God bless. But the fact is, we're trying to provide a successful route to this that is maximized first time through.
At the heart of the reason why we're doing this, to educate people, and that's just another thing to be educated on. Know the facts, do it right the first time. Know the things that need to be in place. Don't mess around, because one of the things I think one of the heaviest things that a lot of workers really need to know, especially people in trades who work, pretty hard physically. Look, you saw the difference between that age 62 benefit and that disability benefit. It's $500 or more a month. And you could get that at any age if you qualify. So it's more likely when you're over 50, right? That's what you said the other day, Tom. But can be done at any age if you qualify. So anyway, now that we covered the Social Security disability content we had on our agenda today, let's jump a little into the Medicare part of it. We're getting a little bit behind, but I think it was important, like Joe said, and we had a hard time getting Joe and Rachel on because I had to talk and still go through this software and let them in. I forgot, right? So anyway, but let's jump in a little there. It was incredible stuff, and it's I think equally important to understand some of these things related to Medicare, because there seems to be a lot of questions, especially with people on Social Security disability, on whether they qualify, when they'll qualify, all that kind of stuff. So let's talk about that for a minute. So first things first, let's talk about who's eligible for Medicare. And it's pretty straightforward. There's really two main classifications when it comes to it. The first is people age 65 and older. Now, there's a couple of caveats, right? You have to be a U.S. citizen or legal resident who lived in the U.S. for at least 5 consecutive years. That's important. You don't have to be collecting Social Security retirement benefits. That's important too, because these days, the full retirement age and the Social Security required age are 2 different ages. So there's a likelihood that you would file that benefit. You would file for Social Security retirement benefits after you file for Social Security, since most people are going to be required to file at 65. Second, and is what we were just talking about, is people who are receiving Social Security disability benefits and then for at least 24 months. Now, Tom, he did hit on something. There are 2 exceptions when it comes to the 24-month rule, and amyotrophic lateral sclerosis, or ALS, or Lou Gehrig's disease, otherwise known as, is one of them. You can get on immediately then, right, Tom?
That's right.
And then the other one is end-stage or permanent kidney failure, or known as end-stage renal disease. Now, let's talk a little bit about the different parts of Medicare coverage. So it starts at what's called Part A coverage. Now, this is the part of Medicare that covers what they call hospital-related expenses, but I think sometimes should really be referred to, or it is referred to, hospital insurance, but might actually be more accurate to relate it more to the expenses that involve nursing care rather than hospital care, because it not only covers acute nursing care in a hospital, but also covers short-term stays in nursing homes, rehabs that provide nursing care, skilled nursing facilities, as well as home health care, and also even hospice care. So when you look at it, there may actually be more care that is covered outside the hospital by a nurse than inside the hospital. Some bullet points as it relates to Part A is there's no premium for this coverage if you have all 40 credits paid into the Social Security system. In 2021, if you don't have all 40, because a lot of people don't understand this either, is if you have less than 30 credits in, you're going to pay $471 a month for Part A. And if you got between 30 and 39, you're just shy, say 1 credit shy, you're going to pay $259 a month for that. And then it also covers, like I said, mostly inpatient hospital, skilled nursing facility, home health care, hospice. Individuals and their spouses are entitled to Part A. Okay. It does have a deductible. In 2021, the deductible for hospital stays of 60 days or less is $1,484 for every hospital stay that's 60 days or less. So it could be a healthy deductible. You can go to any qualified hospital in the United States and who accepts Medicare, and I think probably most of them do. It's available to all people on SSDI after 2 years of receiving the benefit, just like we discussed earlier. So, a few more important details related to A is the deductibles and the coinsurance. Let's just talk for a second on that. Of course, we just mentioned the $1,484 on deductibles that are 60 days or less, of stays that are 60 days or less in the hospital. But if you're in between 61 and 90 days, you're going to pay you're responsible for $371 of coinsurance per day up to that 90th day. And if you if you go into the 91st day and beyond, you're responsible for $740 of coinsurance per day. And that has to do with something called a lifetime reserve day, days that they give you. Not going to get too deep into that, but it does at some point run out and you'd have to pay it all yourself. So you definitely want to think about that when you're making your choices for what parts of Medicare you're gonna take. Second part of Medicare that's important to know about is Part B. So you can think of this as like doctor care and medical services insurance. It helps with the cost of doctor's visits and other medical services that don't require an inpatient hospital stay. The annual deductible is pretty cheap. It's $203 before it kicks in. The thing is, though, Part B in Medicare in general is only going to pay about 80% of your doctor's bills and outpatient expenses. And the standard monthly premium for 2021 is $148.50. Now, it could be less depending on your income if you qualify. And it also could be a lot more depending on your income if you qualify. It may not be something, it's, kind of a double-edged sword, right? That you qualify for. So, and that's something that here's a chart on that. Not going to go too deep into it, but this is if you make for an individual starts at $88,000. That's all, and it could kick in. And for a married couple filing jointly, it's $176,000. So it's you don't see as many people making that in retirement, but certainly can if you're single. And it goes up for single people as high as an income of $500,000, and for married folks to $750,000. Now, the incremental premium increases start at $207.90 and go up as high as $504.90 per person, which you can get as high. Your premium for Part B can actually get up to 3.5 times what the standard premium is if your income's surcharge qualifies you for a surcharge. So you want to be mindful of that as well. Certainly some things that you can think about doing in retirement, especially when it comes to IRAs and things like that, and income you take in or strategize prior to retirement, maybe committing more to a Roth IRA or something to have less income show up. These are the types of things that you might want to think about. All right, so you are guaranteed, this is a good thing. So you're guaranteed, right, that your Social Security benefits are going to stay the same or not be reduced, though, regardless of the annual inflation adjustments that are applied to your Medicare Part B premiums every year. What did you just say, Tom? It's 5.9%?
Yeah, biggest in 39 years.
Right. So that's a good thing, right? Get added to your Social Security. But if your Medicare premium goes up by 12%, they're going to take that 5.9 and they're going to apply it to that, right? And that kind of offsets it. Now, because of something called the hold harmless provision, which was passed in 2006, they're going to say, well, if your Medicare premium goes up by 12% and you only get a 6% inflation raise on your Social Security, and we apply that 6% to your Medicare premium, then you know what? We're picking up the difference, right? Because otherwise your Social Security benefits would go down, right? Absolutely. So this is a good thing, and you want to be happy for that. Now, although Medicare Part A and B are like very good coverages, there's definitely some things to consider before you commit to them. First, they don't cover, like we said, 100% of your medical expenses. They only cover 80%. Plus, they don't cover any routine vision, dental, or hearing expenses, or any custodial-based long-term care that may be needed. Also, their cost-sharing requirements that we kind of just talked about, those deductibles, coinsurance, those types of things, they can add up along with the premium. So you really want to give some thought to which options you take when it comes to these. Plus, you add the Part B deductible, it starts to add up. And here's the big one, really. When it comes to Part A, technically, there's actually no limit on the out-of-pocket expenses when it comes to it. So, it can actually be, if you run out all those coinsurances and all that, you could have a serious hospital bill, serious bills that could really bury you. So you really want to think about that in advance as well. Now, let's talk about D. D is the part that covers your prescription drugs, okay? There's two types. Standalone prescription drug plans, they call them PDPs, and Medicare Advantage plans, they call them MAPDs. The bullet points on them, basically this: premiums and cost sharings vary. Most plans have a gap in coverage, also known as a donut hole. Have you heard of that, Tom, right? This donut hole?
Sure have, and I love donuts, but not that.
Not that one, right? Because if you're taking, the guy on my third floor has a certain rare form of cancer. He's paying, now he has he found, thank goodness, a nonprofit's paying $17,000 a month for that prescription. Okay. How'd you like to be in that donut hole? Right. What that means is you pay certain parts of the year, you're paying certain different percentages. You get to a certain point, usually around the third quarter, I believe, the donut hole. And if you're paying that much, you got to pay it, which isn't fun. So you definitely want to give that some thought as well. Now, Part D also has an IRMA, or also known as the income related monthly adjusted amount. Okay. And that threshold, all the income thresholds are the same. as the ones with the Part B. And then that starts with an increase at the first level, $12.30. At the highest level, goes up $77.10. And that gets added to the $33.06 of the base premium for each person. So it's no surprise, the more you make, what's the old saying? The more they make, the more they take, right? So this is certainly one of them instances. Now, there is a Medicare option that includes all the Part A, B, and D coverages in one. And it's called Medicare Part C, also known as the Medicare Advantage Plan. It's made up of plans offered by private insurance companies. The bullet points go like this. Each plan must have Part A and Part B equivalent insurance in it. Beneficiaries may pay additional monthly premiums for additional services like dental, vision, hearing, annual physicals, prescriptions, something they call the Silver Sneakers program. You heard of this? Right? They give you a gym membership, right? And they'll also sign you up for certain types of exercise classes all on the house. The next one is beneficiaries may also be restricted to go only to plan. Now, this is the one drawback, right? You're restricted to go to only network providers for their healthcare services. So, although when you look at the costs of these plans, if you're a healthy person, may actually be much more viable from a financial point of view. If you're not, probably the traditional A, B, and D is more the way you should think about going. So also, how popular is Medicare Advantage plans? Well, 42% of beneficiaries were enrolled in Medicare Advantage plans in this year. Okay, so it's actually quite a few people, large, not the lion's share, but it's a decent number of people that are actually part of it. And how does the government afford to do this, right? So they pay each of these healthcare companies, their plans, each a fixed amount per employee per year, paid by the program. But each plan actually offers different features as part of their coverage, all of which has to be absorbed by that fixed rate that they're being paid. And they compete with each other. So maybe something to seriously consider if you're on the healthier side. Now, as we mentioned earlier, Medicare Part A, B only cover 80% of your hospital medical expenses. So most people opt to purchase what's known as a Medicare supplement plan. We're not going to dig too deep into Medicare supplement plans, but what you really should know is also they're commonly referred to, you may hear, as Medigap plans, policies. They're offered also by mainly private health insurance companies, but they pay the other 20% that isn't covered by Medicare, as well as what I mentioned before, the earlier deductibles, coinsurances that aren't covered by the traditional Medicare. So they will actually pick all that up. And for a hospital stay, not only can you go past that 90 to 120 days, they'll actually pay for the remainder of that up to 1 full year. So I highly recommend, and I believe most people do, right? Is your experience that most people have supplement plans?
Well, are you talking to me, Brian?
Yeah.
Yeah, I mean, we refer them, to people like yourself to help them with this because they need them.
Yeah, absolutely. Now, they can range anywhere from $160 a month to $250 a month, depending on what your needs are. But I have to tell you, given all the things that they pick up, I absolutely advocate that for the average person. Not how many people are really out there that can self-insure for that 20%. Really not too many, right? Now, here's just a breakdown, not going too deep into this, of the different types of benefits that you would get on a supplement plan. As you can see, they do get pretty specific. They even cover, as mentioned, the fact that they'll cover up the first 3 pints of blood someone receives, or even a certain percentage of, and this is something a lot of people don't think about, foreign travel emergency services, right? You're away. In fact, takes me back, but 30 years ago, I went to Ireland, right? And I had got this terrible sinus infection when I got there. And, you know, your coverage doesn't, good for nothing over there. If you're on that, if you have a supplement plan, you're covered. They're actually part of it. They're going to cover, I think, up most of them 80%. So it's not too bad. So just a little food for thought there. And it also talks about who, and if you get down that list, the coinsurance is on A and B. So honestly, I don't think anybody can live without this. Believe me, take my word for that. Now, let's talk about the enrollment periods. This is the last thing we're going to talk about when it comes to Medicare, right? And you know, most people are eligible for these different enrollment periods based on their situation. And let me tell you, these are extremely important to be aware of, because if you do not abide by them closely, you could end up being penalized. And in some cases, penalties are unbelievably steep and permanent. So pay close attention to these, please. So first, and this is probably, and this is really only applicable to folks on SSDI, right? If you're on Social Security disability, they're going to automatically sign you, automatically. You don't have to call. Automatically signed up at that 24-month period. Is that what you've found, Tom? That it happens, that you don't have to call? Is it usually smooth?
Yeah, it is. And you know, I think John might have had that question. I was looking through some of the Q&A. It's automatic, and I don't want people to be mistaken. It's not 24 months after your case is over. That clock starts ticking from the date you're found disabled. So if it takes a year to get your case decided, well, the clock is gone. So now you only have to wait another 12 months to get that. By the way, 24 months to wait for it is ridiculous. I hate that rule, but you have to. But I don't want people to think it's once your case is over, it's 24 months. It's not. But yes, automatic, absolutely.
On that note, there's one thing I actually wanted to ask you about. It kind of gets into this a little, right? So say you win your case, right? And you're and now, how long is it going to take before you get your first check?
Oh, well, that's, the pandemic hasn't made that any quicker. If you found out you won your case, let's say you got a decision in the mail, it says you won. The old days, I would tell people that within the next 90 days, they should have their first check. It's still around there, but in certain jurisdictions, and we cover all 50 states, but in Pennsylvania, it could be longer than 90 days. I mean, you'll get it. I promise you'll get it. You might get it early, but you're probably waiting at least 2 to 3 months.
Yeah, I mean, I heard too that there's a 5-month hold period or something.
Yeah, that's in the calculation of the benefits. So you don't get paid the first 5 months you're out of work, but in terms of how long it takes once you found out, it's typically about 3 months.
Right. Okay.
Yeah.
So the second, so that automatic happens only with the people on SSD. No one in the retirement realm is qualifies for that. Now, the first enrollment period is one that's custom to everybody who's coming towards being age 65 and when they turn 65. That's referred to as your initial enrollment period. So everybody's got an initial enrollment period, and it's all created around you being the age 65. Now, it actually starts 3 months before that, counts the month you're going to be 65, and then goes 3 months after. So it was a 7-month period. If you miss that window, okay, you could end up in a situation where you're going to be penalized. I'm going to go over that in a second. So now, not everybody at 65 has to file because they may still be working. they still maybe have benefits from their job. So when they go to retire, it's referred to as their special enrollment period. And that starts the day they retire and goes out 8 months to the day. Again, if you miss that period, you're going to end up quite possibly having to pay a penalty. So it just depends on how long you wait past that, on how steep the penalty is. Now, every year, there's something called the general enrollment period, and that runs from January 1st to March 31st. It happens every year. It's mainly for people who missed their initial or special enrollment period, and then they have to jump in, and they're going to have to wait to January 1st or March 31st. So again, if you do qualify for benefits in that period of time, the one caveat is you're going to have to wait to July 1st. So you're going to have a gap, okay, until you get those benefits. And then every year, I think it's mainly for people that are in the plan already, they're going to have the annual election or open enrollment period. And that's when you're going, and that's going to run from, we're actually in it right now, October 15th to December 7th. That's when people can change over plans whenever they, to whatever plan they want. And that pretty much has to happen by December 7th, and your new plan will start on January 1st. So there are important things to remember, and those penalties are definitely something to consider. Quickly to run through them. Part A, for the people who do have to pay, you can actually still pay a penalty if you end up going past that. That penalty is not for life. The rule is that you're going to pay twice the number of years you didn't sign up for. So if you've waited 2 years, you're going to pay a penalty for 4. And then for Part B, for every 12 months you miss it, they're going to charge you a 10% permanent penalty. So if you miss 2-3 years, you could be paying 30% on that. Next one, and the last one, Part D, there's a calculation. The penalty for that's 1% of the national base beneficiary premium, which is right now $33.06. And they multiply that by the number of months that you missed it. So if you missed it for, say, 30 months, they're going to multiply that 1% by 30, and that's what's going to get. They're going to round it up, and then they're by the closest 10 cents, and that's going to be your penalty. And they do that for life. So also, last thing, file. This one they say takes about 10 minutes online. You can do that. You can go to the office. You can set up. These days, obviously, you can't go to the office, but you can schedule a time to go, right? And you can also schedule a time to do it on the phone. You can call and wait, 5 hours, right? To get it to do it online. Or I advocate that you call up the number 800-772-1213, and you set up a time to either do it by phone or online or whatever you want to do. These are the resources that we used for the content today. Rachel's going to put them in our comment box. We're also going to leave this comment box and the software open for about 10-15 minutes after we conclude tonight, because sometimes you may want to go in and copy and paste some of the information, some of the questions. You may want to copy and paste these resources out of there and put it into a document of your own to look over later. So on that note, that concludes our presentation today, but we are going to jump into our 6-question questionnaire. Rachel, are you there? Uh-oh, did we lose Rachel?
Yeah, I think we lost her, Bri. Her computer went down.
Our computer went down? Okay. Well, we're going to do them anyway, and since we're going to leave that open, we're going to get back, and I think I'm going to try to open this up and see who can see who answers these. You're going to put your answers in the comment box, okay? And so, first question: in what year were Social Security disability benefits added to the Social Security program? In what year? First person to get that right. Oh, Bob, 1956. Bob, you're going to win a $10 gift card to your favorite store. I think Bob won one last month. Right, Yvonne, you just missed it. He got it in right before you. Sorry about that. Maybe you'll get this one. So, where can you find an estimate of your Social Security disability benefits? Where can you find it?
Bob.
Online?
Bob's got him on speed dial.
Statement. Yvonne, you got it. On your statement. All right. Okay. Who's eligible for Medicare benefits? Who's eligible? Come on.
Bob.
65 or older, yes. Who else? We're going to give out 2 for this one. Everybody with disability, yes, exactly. We're going to give 2 out. That was Robin. And, oh, no. The first disability was Craig. And the first 65 was Christopher Dougherty. You got it. So we're going to email out you guys, and you just tell us back what your store is. We just go online, buy the gift card, we email them to you. Okay. 5th question. Oh, wait, no. Oh, yeah. 5th question. What does Medicare Part A cover in general? In general, the type of insurance they call it. I'm helping everybody. Come on. You got it. You got it. Come on. Medicare Part A. What does it cover?
Everybody said hospital. Isn't it hospital?
Hospital, yes.
What are
Who
you
has the
looking
first
at?
one? It didn't pop up right away.
About
Hospital.
10 people said hospital.
I didn't see it.
Look, it's tough to be the host, Joe. Come on, man. Go
That's
easy,
true.
bud. You know
He
that.
needs Medicaid Part D, the one with the glasses.
He needs the vision.
Yeah. Okay, well, it looks like Craig hit that.
Meg was quick.
Yeah, he hit it good. So Craig, you're gonna get 2. That means you get $20 gift card. That's good. All right. 6th one. That's the 7 questions on this. What percentage of your overall Medicare expenses does a Medicare supplement plan cover? Who was the first one that said 20 there? Robin? No, Bob? No,
I thought it was Robin.
it was Robin. No. Yvonne. Yvonne was the first one that to say 20. Yeah. Got some quick triggers out there. All right, final question. When does your initial Medicare enrollment period start? This is a little tricky. A little bit tricky. Your initial enrollment period. 64 and 9 months. Yes, exactly. 3 months before the first day. Who put that? Who had that one? Cindy. All right, you're the winner of that one. So, and yeah, so that's our 7th question, our final one. So now we're going to take some questions. We're going to look in the Q&A. Anything that you saw in there, Tom, that jumped out at you? So first question.
I think if that's Monte Elias, or I hope I'm saying that right. So once you qualify for disability and Medicare from SSA, what else do you need to do? Is it permanent? So I think I talked about this, but I'm happy to reiterate it. So you're on it for as long as you need it. And that could mean you're on it for the rest of your life until you hit your full retirement age, and then it just converts over to Social Security retirement. Or that means you're on it for a couple of years and you get better and you go back to work. So it can be permanent, to answer the question, but it doesn't have to be.
Okay. He's got another one after that.
Yeah.
You want to tackle that one? Does income that is not
So-
earned matter?
So that's, a really good point for Social Security disability. So if you're one of those individuals who've worked and paid into the system and you have investments and trust, it doesn't matter. I mean, I'll give you a quick story. I had a client who won his disability case, got $1,200 a month from disability, and about 2 months later hit the lottery for $750,000. And that client still gets his $1,200 a month in disability because he paid into the system. That was his money. So non-earned income does not affect SSDI. It definitely affects people who are on SSI. That's a much longer conversation, but I think that's a better answer right there.
Okay. So John Bland, if someone just started collecting Social Security disability, when can they collect Medicare?
So it's 24 months from the time they're found disabled. So John, in that scenario, what you'd want to know is when was your member found disabled? What was the date that they were found disabled? Add 24 months to that, and that's how you know when they'll start collecting.
Right. Another from Monte. Once you have disability and if you can work part-time, what are the rules so you can not lose your disability? And if you can work full-time, after that, get disability and then relapse, what is the process for getting back your disability?
Great question. So I'll try to make this quick, although this could be a long one, but we'll go quick. If you're on disability, they actually allow you to work and earn up to $940 gross a month and still get your full SSD. So if you're on SSD and you want to find a job that's going to pay you under $940, you can do that for the rest of your life. If you make $1 more than $940 in a month, you trigger something called a trial work period. And that means you have 9 months to make as much as you want, but after 9 months of making more than $940, they're probably going to stop your benefits. So what's that mean for people who are on disability? That means you can try to work. And if it lasts 3 months, and let's say you're making $2,000 for those 3 months a month, but you can't do it anymore, you won't lose your benefits. So they actually give you a trial period where you can make as much as you want and see if you can keep that job. But if you really want to know the trick, it's if you're on SSD and you're making less than $940 and you never cross that threshold, you can work and make $940 a month for as long as you want.
Tom, I've heard things about, you've heard of an ABLE account?
Yeah, I have. I'm not too familiar with it, but I know that an ABLE account, it will not impact someone's SSI. It's really for SSI, Brian, not for SSDI. Yeah, it enables somebody to put money away that won't impact it won't say you have resources and assets and then kick you off of SSI. So yeah, it's not something I deal with often, but I do talk about it.
Theoretically, could someone on SSI work a job, make, more money than they normally have a limit to?
No. In fact, now it's not for work income to go into that account. It would be for, let's say you had I don't know, a relative died or something, or there was another benefit that came from you. But if you're working and you're getting SSI, it almost is a dollar for dollar reduction. So if you're getting, $700 a month in SSI and you're making $700 a month at your job, you're almost going to wipe out your whole SSI.
Right. Okay.
Yeah.
What else we got here? Okay. Last question. When you're a federal retired employee, is it best to keep your federal employee insurance versus Medigap? So that's a good question. And you're talking about for when you're already retired, right? It's my understanding that the federal employee insurance, or anybody who collects on any type of employment insurance, it doesn't count the same as if you were getting insurance through when you were working with them, as it applies to your special enrollment period. So I think you should discuss that with Social Security, with the people with Social Security, to make sure that you're not being counted towards any type of requirement. still, because that's not what they call creditable insurance. I believe they will, if it is creditable, which that sounds like it might be. They may make that exception, but I know that if it's in retirement, it gets a little tricky versus work-related health insurance versus when you're working. It's a little mucky. Any input on that, Tom? Or you have any thoughts about that? No? Okay.
Yeah, I mean, I try to leave that to the experts like you.
Yeah, I mean, that's, again, I don't consider myself an expert. I call myself more of a specialist because I, deal with it a lot. I am, affiliated with folks that are experts, and I do reach out to them quite a bit for when I don't. But that's my understanding of that. I will actually reach out on that when it comes to that one, though, because, I do read a lot about it. And something I read recently said that, I think if they have to consider it creditable insurance, which is something that's equal basically to what they would offer. If that is, then it probably will pass. All right, so
Brian, why don't you and Tom give your contact information in case anybody has any additional questions.
You got me right on that, Joe.
Great minds thinking alike.
Jump into that. Beat me to the punch. So first of all, though, I want to thank everyone who took the time out of their busy schedules to attend our workshop today. I truly commend you for being the type of people that are looking to better inform yourselves. I'd also like to thank our special host for doing this with us as well, you, JDoc, of the Injured Workers Advocacy Program, which we really didn't talk too much about. At some point we will, maybe. And PhillyLabor.com, and a host of the Labor Show on 1210 AM. So definitely want to thank you, Joe, for doing it. And yes, if you can, how would people get in touch with you and, give them a little information about you if they want to?
In touch with me?
Yeah.
Just go to PhillyLabor.com or, tune into the Labor Show every Saturday night from 6 to 8 on Talk Radio 1210 WPHT. And certainly, my email, joedoc3@gmail.com. Certainly, any questions we can answer, we're happy to discuss. Well, obviously we want to thank Tom Giordano of Pond Lehocy for lending his expertise. And of course, Sam Pond, who is also, between him and Tom, they're so passionate at this, and what they do for our labor community is really unprecedented, as well as the general public, well over and above our labor community.
Yeah. Tom, how can people get in touch with you?
Yeah, I just popped my email on there, tgiordano@pondlehockey.com. I put it in the chat for everybody. Obviously, you can visit pondlehockey.com. And I want to thank you, Brian, and thank you, Joe, for not only including me, but for everything you guys do, not only for the members of the union community, which is near and dear to my heart, but, for everybody. You're really trying to educate people, and I appreciate it. I'm always available to help. Whenever disability's up, you can count on me, man.
You're our man. You're our man.
That's right.
I also want to thank my wonderful partner in business and life, Rachel Dougherty. And Rachel just, we lost her somewhere along the line there. So, but she does these webinars. She uses the moderator. I had to jump in and try to do some, struggle a little bit with it, but I fortunately pulled that off, but she usually does that. And again, folks, my name is Brian Dougherty of PLC Financial Solutions, located in the Fort Washington area. You can get in touch with me either if you have any related questions on this topic today or anything else, really. Call me at 215-804-9708, or you can go to our website at plcfs.com and email me also, or schedule a complimentary Q&A meeting. I'd be happy to discuss anything really that you'd like to. Also, folks, I hope to see you on our webinar next month. We do them on the last Tuesday of the month, every month at 7 p.m. And our topic next month will be understanding long-term care and how it could apply to you. So have a great night, and hopefully we'll see you next month. Thanks.
Thanks, everybody.
Guys.